Hey guys, Dr. Davin Lim, board certified laser dermatologist. Today we'll be talking about non-surgical facelifting. So I do facelifts myself, so mini S facelifts. We're not going to go there today. We're talking about ways to help lift the face without surgery. So we can use fillers. We've talked about fillers in the past. We can use energy devices. So energy devices such as Ultherapy, which is high intensity focused ultrasound, and that works really good if your collagen is good. So if you've got loose collagen but not sun damaged collagen in a certain skin type, so basically you've got to have mild to moderate laxity, Ultherapy is an excellent treatment, and that can give you between a half to a 1.5 centimeter lift. Thermage. So Thermage is one of those things where it can work or it can't work. Thermage is a very racist energy device. I'll tell you why. It's because it's more suited towards ethnic skin types because of our collagen. We've got thicker collagen, and Thermage works best in this setting. So today I'll be showing you not liquid facelifts, not vampire facelifts. We can do that at another stage. I'll show you thread lifting. And what we're going to do is we're going to use threads, and we're going to lift the jowl lines and give a slight lift on the lower face and mid face. So you can see how I do it. It's a very, in my opinion, it's a very easy procedure. I'm used to cannulating all the time, using cannula, so I'm in that subdermal plane all day, every day, and it's a very, it's a very nice process. My mum's had it done, and you'll see my nurse who helps me, her mum has had it done, and it just works very well. Thanks for watching, and I'll show you how it's done. Vicky! Hey, Vicky's been a passion of mine for God knows what, it's been about probably about 8 years or so, yeah. 8 years or so, yeah. So Vicky, I've done many things for you. We've been through many detoxes together, alcohol-wise. You're detox now, I'm detox now, that's cool. Hey Vicky, what procedures have I done on you so far? We've done some...
So far we've done some lifting,
yep.
Had some laser treatment,
yep.
And some Botox.
Very good.
And some fillers.
And some fillers, yeah. So we got some good lifting around your cheek areas, haven't we?
Yeah.
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 But what's your primary concern today?
At the moment it's my jowls.
Yep.
And my kind of smile lines turning down, and I've seen photos and I can just see these lines here, and that's a real concern to me.
Okay. Now you give me a smile now and relax. Okay, so what we're going to do today, we're going to work together. So you've had 2 Valium, so you'll still be awake with this,
yeah.
Okay? But what we're going to do is we're going to work together, and we're going to use some thread lifting, okay?
Yeah.
So a thread lift in your situation, I think would be ideal because, just hang tight, just look straight ahead, because I think you've got moderate laxity. You haven't got mild laxity and you haven't got severe laxity. You've got moderate laxity. And if I can achieve a lifting, just a tiny bit of lift like that, where we lift by about 0.5 to 1 centimeter, it's considered successful. So we've got lots of before photos. We've got the before video. So I'm going to do a before video of you 3-dimensionally, and then we're going to see what happens when we do the thread lifts on one side of the face. And then I might be evil and let you not have a thread lift on the other side for 3 weeks and see what happens. No, I'm just joking. We'll complete everything in one day. So a bit of Valium just to actually calm you down. I'm calmed down myself, but just to calm you down, and we'll see how it goes. Okay, you ready for it?
I'm ready.
Okay, cool. So we'll see how Vicky goes in the next half hour or so.
Okay. Bye.
So what are thread lifting? This thread is called poly-L-lactic acid, and it contains barbs. Now you can see me inserting the needle first. It's like a cannula technique. I do a small incision first with an 18 gauge needle. Then I position the barbs in a particular direction. So the vector plane has been predetermined prior. So I've done all my drawings before and I know where I'm lifting. You can see here the pre-markings before in another case. And basically what we're doing is we're aiming for the exit point here. And we're in this subdermal plane. So we're just under the dermis in the subcutaneous tissue. Now it's a very, very painless, well-tolerated procedure because there are basically only 3 points you need to anesthetize with each level. Basically the entry point, the exit point, and the other exit point. So basically 2 exit points. And the most critical part of any thread lift is to assess the suitability of the patient. So remember, not everyone will benefit from a thread lift. A thread lift is not a substitution for a facelift, and we can use energy devices such as L-therapy or Thermage if the collagen is good. In Vicky's case, because she's got poor collagen, I decided to use a thread lift. Now, a thread lift in this situation can help elevate the jowl lines and the marionette lines by up to 1 centimeter. So if patients have realistic expectations, they get good gains. So you can see here the anatomy behind a thread lift. We're going in the actual subcutaneous tissue. We're not going too deep. That's why you can see me lifting all the time and seeing what level I'm at. The threads goes through, and you can see following or trailing the threads, there's a series of cones. Now what the cones do is they provide counter traction so that when we pull on the skin like this, the skin lifts and basically causes an elevation. The threads dissolve over a period of between 12 to 18 months. Now the reason why I prefer these threads compared to PDO threads is safety and predictability. The most important thing for me is actually safety of the patient. In other words, no suture reactions from the patients. I've been doing thread lifts for about 10 years now, and look, there's certainly physicians who can advocate PDO thread lifting and all the other brands out there. Realistically, there's 2 or 3 dozen brands out there. I like the Silhouette soft threads because they're made of polylactic acid, basically suture material. And the great thing about it is the predictability, because with the cone system delivery, you can see me massaging here and guiding the vector of lifting of which I want. This also stimulates collagen over the next 3 to 4 months. And once again, this dissolves over about 18 months. Very safe, very predictable, very easy to do. So let's hear what Vicky has to say. Now let's have a look at yourself now.
I can see a big difference here.
Big difference there, yeah? Cool. That's what we're after. Patient's expectations are great. We've got the lift. She's got areas of bruising. Those areas of bruising will dissipate in the next week or so. And like I said, the best results from this are 3 to 4 months down. Got a little bit of swelling on your forehead because I've just treated you with Botox as well. But otherwise, give us a smile. Yeah, there we go. Big smile. I was checking her nerves, just make sure I haven't hit anything. That's great. Okay guys, so that's it for Silhouette thread lifting. See how easy it is. A few more before and after cases. You can see once again a good gain with the marionette areas here and here as well. This area is really hard to treat because of the jowling, so this is where Silhouette comes in handy. So guys, thanks very much for watching that segment on how to do a thread lift, or in this case a Silhouette soft thread lift. So you can see there are many ways to actually lift the face without the need for surgery. Sure, I use surgical procedures, facelift procedures for patients who need it. But in this case, we can achieve a good lift of the lower to mid face without the need for surgery. There are many other ways to lift the face. We can use non-energy devices, for example, vampire facelifts. We can use Juvederm, in other words, liquid facelifts. We can use energy devices, for example, RF microneedling combined with PRP. We can use lasers. We can use many methods. Thermage, HIFU, using L-therapy. So once again, so many methods. My advice to you is, if you're thinking about having skin tightening or face lifting, see someone who's qualified to do any of these procedures. Everything from surgical procedures all the way to non-surgical procedures. That way they will find the best method for your skin. Because remember, what you see in this video is not you. It's this person, is Vicky, right? And it's what she wants. So meeting the patient's expectations is very important as well, because some patients want a facelift, and I do give them a facelift if they want that. While some patients are risk adverse to surgery, and then I've got to find a solution for them. So remember, individualizing a treatment is the key to success. Guys, thanks very much for watching this video. Please subscribe if you like more information, and please subscribe because I really need some subscribers to reach that magic 100,000 subscriber mark. I'll see you next Saturday, and take care. Bye.